So this is Prof. Tan. Hi, Prof. Tan. Prof, just a bit of a background information for those who do not know who is Prof. Tan. Prof. Tan has did her fellowship in Edinburgh Royal College of Physicians, am I right? And also further on her fellowship in Melbourne, doing specializing in epilepsy. She did a lot of research in not just in epilepsy, but also in stroke, neuroinfection, and migraine. And she's a very active council member in Malaysian Society of Neurosciences. She is now a senior consultant physician and neurologist at University Kebangsaan Malaysia, UKM. And we are very honored to have her, the head of neurology actually, to share her topic on epilepsy myths and facts. Yes, Prof. Tan?
Thank you, Sylvia.
Okay. So I will pass the time to you. Without further ado, we will let Prof. Tan to pardon me. We'll let Prof. Tan to share her topic for today. Yes, Prof. Tan. I'll leave it up to you.
Thank you, team. Thank you for Farouk and Dr. Shirini for inviting me to give this talk. So I will share with you my lecture today on myths and facts about epilepsy. I'll try and do it both languages. Okay. So what do we know about the myths and facts about epilepsy? Okay, so the
sorry, Prof. Full screen. Okay, that's good.
Yep. Okay, so the myths is people think that sorry, it's going very fast. Okay, so the myth is people think that epilepsy is made by some due to magic, or it was being possessed. Okay, but in fact epilepsy is due to this abnormal or excessive electrical brain activity. Okay, so mitos ialah sawan yang berpunca daripada perbuatan ahli sihir atau dirasuk, tetapi faktanya ialah sawan berpunca daripada gangguan fungsi otak yang disebabkan oleh cetusan aktiviti neuron yang berlebihan. Okay. Apakah sejarah epilepsi? Okay. So the history of epilepsy goes way back in 400 BC, where Hippocrates first wrote the first book on epilepsy. Hippocrates adalah orang pertama yang menulis tentang epilepsy. So in the early 19th century, they didn't know much about it. Okay, it was not until 1860 where Sir John Hughlings Jackson documented that the seizures are a disorder of the brain. So sawan berpunca dari otak, mengikut ahli saintis termuka Sir John Hughlings Jackson. So epilepsy ini berasal daripada perkataan Greek, comes from the Greek word epilambamin, which means to seize or attack. Maksudnya adalah serangan. Dan the myth is epilepsy is not a common condition, and not many people have got this condition. Okay, in fact, is in the worldwide around 65 million people suffer from epilepsy. New cases of patients with epilepsy around 40 to 70 per 100,000 population, and lebih kerap di negara membangun. It's more common in the developing countries like Malaysia, right? Because problem with infections of the nervous system, because of road traffic accidents. And in our hospital, we have about 300 to 350 patients.
Sorry, Prof. Tan, can you do the presentation mode? Yeah, thank you, Prof.
Okay, sorry. Okay. The mythos is only children can get epilepsy. Uh, Children only who got epilepsy. In fact, epilepsy can occur in all ages. Boleh berlaku dalam semua lingkungan umur. So even you're young, you're adults, or even you're old, you can have seizures. What is the incidence of epilepsy? Apakah insiden penyakit epilepsi? So you can see this graph here. There's a bimodal. So in the very young age group, or in the babies, you have this because of masalah genetic, because of genetic disorders. Then you can see in the adults, it sort of plateaus off. And then in the older generation, in kalangan orang-orang dewasa tua, disebabkan oleh penyakit bara, seizures come on because of brain tumors. So they have increased incidence in the elderly age group. So the myth is, atau mitos, sawan hanya melibatkan kekejangan otot kaki dan tangan. So seizures only affect the limbs, the upper and lower limbs. The fact is, the seizures can occur any type. You can have limb involvement, you can have abnormal sensation, you can have even visual disturbances. Not only it affects the jerking of the limbs only. Okay, so you can feel abnormal sensation. Sometimes your eye vision goes a bit blurry. You see flashes of light. So those may be the first clue of a seizure. How do we classify seizure? Bagaimanakah kita klasifikasi sawan ya? So ini dibahagi kepada focal. Focal artinya pada satu bahagian di otak, okay? Atau menyeluruh. That means it occurs throughout the brain, or you have another bullet, unknown, tidak diketahui. So focal in one area of the brain, and it can occur also generalized, the whole brain may be involved. So under the classification, you can have this seizure classification, either it's focal or generalized. So focal, you have aware seizure. So you may have suddenly, you're aware, but you can get some twitching of your limbs, of your face, or you can have some funny sensations in your hands. And the generalized onset, you can have tonic-clonic movements, meaning the jerking of the limbs, or you can have absence. Absence, you suddenly go blank, right? So that can be a seizure as well. So the focal seizures, so the focal aware seizures, that means sawan yang berlaku semasa pesakit sedar. Pesakit sedar, mereka mengalami simptom motor ya, kejang bahagian kaki atau tangan ya, sensory ya, perubahan dalam the numbness, autonomic changes. Sometimes you may get some flushing, the blood pressure changes. Okay, so these are focal aware seizures. That means the patient is aware during the seizure. Focal impaired awareness seizure, pesakit tidak sedar semasa sawan berlaku. The patient does not have awareness during the seizure, right? So the patient may have some changes in the motor symptoms, sensory, also autonomic, but the patient is not aware during this attack. And we have the generalized seizures, as we mentioned briefly. The motor, the usual one that we see is the tonic-clonic, the jerking of the upper and lower limbs. Clonic, that means the limbs start the jerking. Tonic, the limbs become stiffened. Myoclonic means suddenly like jerks very abruptly. Okay, and the absence are the ones that when they're talking to you, suddenly they go blank and then they resume their talking. Okay, what are the features of the seizures? Apakah ciri-ciri sawan? Boleh terdapat perubahan dalam emosi, emotional changes, automatic behaviors, kelakuan automatic. You can have some the hands start to move or the mouth start to chewing movements, right? They have rhythmic movements. This feeling of deja vu, perasaan deja vu, artinya you come to a new place but you feel that you have been in that place before. The body becomes very lesu, is like very tired following the seizures, or the the, the body becomes very stiff during the attack. So here you have see all the symptoms, this jerking, language, all right. Suddenly they are doing something and then they freeze. They sort of stop short of what they are doing. Sometimes they find abnormal smells or abnormal taste or inner vision. Okay, so the next myth is epilepsy boleh berjangkit. Alright, so epilepsy is contagious. So the fact is epilepsy is not an infection. Alright, it is because of this abnormal electrical brain activity. Disebabkan oleh masalah gangguan neuron otak yang berlebihan. Dan terdapat penyebab tertentu. There are several causes to the seizures. What are the causes? Okay, so it can be a structural cause. So if you do a scan, you find the patient has a stroke. There's black areas in the brain here, a tumor. This white lesion here on the MRI scan here shows there's a growth that's pressing on the brain that's causing the seizures. Genetic conditions. So genetic conditions are usually in the childhood. Either this it as genetic or juvenile myoclonic epilepsy or childhood absence seizures. You may have developmental problem like tuberous sclerosis, where the patient will have some this like look like freckles a bit on the face, okay, and then the abnormality in the you can see the skin growth in the nails, okay. Then some patients you see this, they have this abnormal purplish stain on their face and their limb. This is Sturge Weber due to the abnormal formation of the blood vessels. Then infection is another big group. So infection that causes the seizures. So commonly we have in our country tuberculosis. Right, so TB can affect the brain. Infections such as bacterial or viral also can cause the brain infection. Jenis-jenis penyakit yang mengakibatkan sawan ialah batuk kering, malaria. Malaria is transmitted by Plasmodium malaria, all right. Toxoplasmosis, all right, this infection, protozoal infection, congenital infection, transmission to the babies. Like here you see the Zika syndrome, the baby is born with this small head, microcephaly, and they have damage to the brain causing seizures. Then we have the next big group, metabolic conditions. So keadaan metabolik, perubahan dalam bahan kimia dalam badan kita, abnormal biochemistry in the blood. Let's say your kidney failure, right? You have problems in the amino acid. Also can lead to this electrolyte problems causing the seizures. So masalah ginjal, masalah dengan asid amino. Porphyria juga ialah satu masalah metabolisme yang boleh menyebabkan perubahan biokimia dan menyebabkan sawan. Then we have another big group, the immune mediated problem, system immunity. Sometimes our immune system becomes haywire, right? So the immune system is supposed to protect our body, right? Sistem immune sepatutnya untuk membantu menghalang, all the kuman-kuman yang masuk ke dalam badan kita. Tapi kadang-kadang sistem imun ni dia tersilap, dia menyerang balik kita punya badan dan bahagian otak. Dan keradangan otak, macam this condition called limbic encephalitis, so meaning that there's antibody that's attacking back our own cells, especially the brain, will cause seizures. Okay, so we learn about the different type of seizures, what the causes of seizures. So what do we do? Apa yang kita kena buat sekiranya pesakit ada sawan? So the myth is a lot of the patients come back, you have to put something in the mouth. Okay, mitosnya anda perlu memasukkan sesuatu dalam mulut pesakit. In fact, this is very dangerous. Ini sangat bahaya. Jangan masukkan apa-apa dalam mulut semasa sawan, because pesakit boleh berhenti bernafas dan mencederakan mereka. So in fact, you don't put a cloth or anything. So you put a cloth in there or put your finger in there, you can stop the patient from breathing. Alright, you can suffocate the patient. So do not put anything in the patient's mouth. Jangan masukkan apa-apa dalam mulut pesakit. Okay, another myth is setengah makanan boleh mencetuskan sawan. Some food can make the seizures come on. In fact, these are the condition that the seizures can be triggered. Sawan boleh dicetuskan oleh kurang tidur, not enough sleep, hypoglycemia, when the glucose is very low in the body, also can cause seizures. If you're tired, extreme stress, you're having fever, demam atau jangkitan, if you're having your periods for women, or you missed your medication, tidak makan ubat, semua perkara ini boleh mencetuskan sawan. Another myth is pesakit perlu dipegang secara kuat semasa sawan. We have to hold the patient when the patient is jerking. That is a common myth. In fact, we try not to hold the patient very tightly because you can injure the patient. So what are the steps we must do when the patient have a fit? Langkah-langkah semasa sawan. Kita perlu toleh pesakit untuk mengiring ke sebelah. You must help the patient to lie on the side. Okay, cushion the head. Pastikan protect bahagian kepala. Pastikan longgarkan collar baju di leher pesakit dan papas kepala pesakit. Dan pastikan tiada mulut dan tiada benda dalam mulut pesakit. So you cushion the head, loosen the tight clothing, turn the patient to the side. Then you have to time, watch the seizure with the watch. Pastikan kita time sawan tu dan tidak masukkan apa-apa barang dalam mulut pesakit. Do not put anything to the mouth. Okay, so stay with the patient. Kita kena berada dengan pesakit sampai pesakit sedar. We have to stay until the patient has regained the consciousness. Okay, so they don't hold down the patient. Right. So most of the seizures will complete. They will stop by 5 minutes. Okay. If it doesn't stop after more than 5 minutes, then you have to dial for help. So usually after the seizure, the patient is very, very tired. So you let the patient rest and sleep. Lepas sawan pesakit tu biasa sangat-sangat penat. So kita perlu bagi pesakit tu rehat. Okay. Okay, the next myth is pesakit epilepsi tidak boleh bekerja. Right? Patients with epilepsy cannot work. In fact, patient can work like anyone else. Okay, so only there are a few tips is patient cannot drive, right? Cannot ride the motorbike or the bicycle. You cannot swim, right? You cannot hold all these firearms. Like if the patient is a police or in the army, you must uh, give them a letter saying that they have epilepsy, so they cannot hold all these firearms. And you have to take the medication following the time and recommendation. Okay, so the epilepsy patients, you must advise them not to drive, swim, climb heights, or ride a motorbike or bicycle, because you don't know when the seizure is going to come on, right? And then the patient may fall and hurt themselves, or even worse, they're driving, they meet an accident. Okay, the other myth is, the mitos ialah pesakit tidak perlu makan ubat dan makan ubat sahaja bila seorang berlaku. So another common myth is the patient say, oh, I can only take medicine when I have the fit. Other than that, I don't have to. No, the fact is the patient must continue to take the medication to control the epilepsy fit. Okay, so these are a lot of medications. I'm sure some of you will recognize the name of those medications here on, like Tegretol, Lamotrigine, all right, Topiramate, okay, Valproate. Okay, so these are the different drugs for different seizure types. Okay, and different syndromes also. Your doctor will tell you what are the syndromes that you may have, and um, give you medication, right? Some medication helps, but some medication may may make the seizure worse. Okay, another myth is pesakit epilepsi tidak boleh sembuh sepenuhnya. Patients with epilepsy cannot be cured. The fact is, yes, medications can control the epilepsy, terutamanya if you have this idiopathic generalized epilepsy. Sekiranya ada masalah idiopathic generalized epilepsy, sawan boleh mengawal epilepsi. Dan pesakit yang ada focal epilepsy, patients with focal epilepsy, if you have a tumor or a hippocampus sclerosis, hippocampus sclerosis artinya parut di bahagian otak, dan bila pembedahan otak dilakukan, that means you remove the scar tissue, right, the tumor, the seizures will be much controlled. So this is for a small group of patients, right? Let's say like this one, it's a tumor here, there is a growth in the brain. You can refer to the neurosurgeons to remove this, and the seizures will be better controlled. Okay, the next myth is pesakit epilepsi tidak boleh kahwin atau mempunyai anak. Okay, so a lot of epilepsy patients come to us saying that they cannot get married or have their own family. In fact, the epilepsy patients can have their family, they can marry, and they can get pregnant also. Okay, so if there are women with epilepsy, so counseling untuk pesakit wanita dengan epilepsy, we have to explain to them with the type of medication and the dosage and the risk to the unborn baby and the side effects. Kita perlu berbincang tentang jenis dan dos ubat dan risiko kepada fetus dan kesan samping. Ramai pesakit epilepsi mempunyai bayi yang normal dengan risiko kecacatan rendah jika dos ubat yang rendah. Dan risiko kecacatan bergantung pada jenis dos dan bilangan ubat saraf. So a lot of epilepsy patients, the women will have a normal baby and a low risk of congenital defects if the medication is well planned, them a low dose, and the risk of the abnormal malformations in the child will depend on the type, the dose, and the number of anti-epileptic medications. So there's extra precautions when we follow up patients who are pregnant with epilepsy, because the epilepsy patients, we need to monitor them closely, because sometimes they are very tired when they're pregnant, not enough sleep, right? Sometimes they forget their medication, and we have to monitor them with the serial growth for the child, also with the baby. So pesakit wanita perlu dipantau dengan very regular, okay? Sebab risiko sawan boleh berlaku jika tidak cukup tidur atau kepenatan, dan kita perlu pastikan pesakit tu makan ubat dengan dos dengan compliant, ya. Dan kita kena rujuk ke klinik antenatal untuk memonitorkan perkembangan fetus. So the next myth is epilepsy patients have to live by themselves. No, epilepsy patients do not have to live by themselves. They can have a normal life like everyone else, with your family and your friends. Okay, so we can see here we have the epilepsy patients who join us for the program, and they go out to have a lot of fun and activities. This one is courtesy of your Persatuan Epilepsy Malaysia program. You all have a lot of programs, so I think it's a good job that this Persatuan Epilepsy helps in our patients' welfare as well. So thank you and terima kasih.
Thank you, Prof. Tan, for your sharing. Any questions from the audience? Oh, we have one from Carmen. When can a epilepsy patient stop taking medication? So, Prof. Tan, what's your view on that?
Yeah, okay. So usually we will continue the medication and until the patient is 2 years seizure free. That means no more seizures for 2 years, and then we review them again and see whether the EEG is okay, right? Everything is well, because sometimes, and what sort of epilepsy they are having, right? Because some epilepsy syndromes, they need the medication only a low dose. If you start to take them off, the seizures may come back. So by and large, it's 2 years, all right, fit free.
Oh, the same person also asked, is it through try and error where you get them to comply to their medication?
Is the patient can only get their medication when complying to try and error? No, we don't do the try and error part. We look at what is the seizure type and the syndrome, right? Based on your scans and your EEG, right? The certain medication work well for certain type of syndrome, certain doesn't work. Okay.
I see. Any other questions?
Okay. Another patient say, I am always taking medication for 1 year, but last week, couple of times I forgot to take. Yeah, is it quick to attack? Yeah, sometimes it does, because once you don't take the medication, the level of the drug falls low in your blood levels. Okay. Why taken medication still can't 100% control eye seizures? Eye seizures, I am not sure. I think you mean focal seizures, right? Yeah. So the focal seizures sometimes, correct, may not be 100%. So focal meaning that there is a trigger in the brain. All right, there's a trigger or focus in the brain that's triggering up So we have to find out, is there a lesion or focus in that brain that's causing the trigger. Okay, so usually like 30% of the patient, may still not be seizure free. Is one aware that the periods trigger the seizure? What can one do? Okay, so they're talking about menstrual seizures or catamenial seizures. So catamenial seizures meaning that during, it's got to do with your hormones, when the menstruation, right, the estrogen and the progesterone. So during that time, if your seizures are um, brought on during the menses, right, we can advise you to take certain medications like frisium, clonazepam, or Dimox during the menstruation. You can start like a few days, 2 or 3 days before the seizure, if your seizures are regular. Okay? So that sometimes can help to reduce the menstrual triggered seizures. Okay. Can the hating the job we are doing on regular basis trigger the seizure for epilepsy patient? Hating the job, okay, that means you don't like the job. Okay. Well, well, true. I mean, if you are not happy, you're stressed, sometimes it can also precipitate the seizure. Okay? So if patient grinding teeth, does it mean he will have seizures after some time? Well, grinding teeth, there's a certain word. Grinding teeth means bruxism. Now, some patients, not epilepsy patients, that's normal persons, all right? Sometimes they have this um, bruxism. We call it like teeth grinding when you're sleeping. Okay, so it doesn't mean that they will get seizures. Okay. Okay, after 2 years seizure-free, stop medication, patient needs to continue doctor appointment. Yes, I would suggest that you will still continue because after the seizure, we don't know when the seizure may come back again. Are there long-term effects of clonazepam? Okay, clonazepam is under the benzodiazepine. Benzodiazepine makes you very sleepy. All right. Usually you take at night only. So usually we don't advocate that you take during the daytime because you may be driving. You may fall asleep while you're doing your work and all that. Long-term effect is if usually it's very hard to take you off clonazepam once you are on that. Will epileptic attack cause brain damage or the other way around? Well, okay. So you're talking about infection of the brain. Okay, so infection of the brain can actually cause abnormality in the brain, and that causes the seizures. Of course, if the seizures become very uncontrolled, we call this condition status epilepticus. That means the seizure keep on recurring, and then that also itself can not only cause the brain damage, it can cause your other organs to be affected. Yes. Okay, so we don't want you to stop your medication all of a sudden and then you get this continuous seizures. Okay, that also can cause the brain attack. Can we totally recover from epilepsy one day with no necessity? Well, it depends on what type of epilepsy you're having. All right, if you have the idiopathic generalized epilepsy, that means the seizures are usually well controlled with things like valproate, and they become seizure free after 2 years. Then you can take them off. Okay. If you have this focal epilepsy, that means
combination of drug outage.
the brain,
The brain.
neurosurgeon can resect that area, then you can be seizure free. Okay.
All right.
Brain, Ahmad is the cool.
Hello.
Sorry. Yes. So where are we now? I'm trying to read the question.
Oh, you have answered a lot of questions regarding myths and fact. I'm sure the audience have a lot of questions to ask. Is epilepsy by birth, and is the brain damage is permanent, and
Yeah.
there's no
Okay. I'll
cure?
try to answer a few more. Because I think we are a bit late, right? We have the next program, right, Sue Tim?
Yes, yes, yes.
Yeah.
So
Yeah.
probably you can
I
take
will
in.
write on the chat group, so I don't want to keep everybody waiting for the
Or
next.
maybe we can
Ah,
have a question towards the end as well. I'm sure they'll have more questions, Prof.
Hey, hi,
yeah.
Shirini.
Hi,
Yeah.
I've been listening, by the way. I came in a bit late, but I'm listening
No
to you.
worries. Yeah. Got a very enthusiastic group.
So probably now we'll keep the Q&A at the later session if we do have